Hello, everyone. Can everyone hear me? Oh, thank you. Okay, thank you for responding. Perfect. Okay, thank you, everybody. I will get started with my presentation. Can everyone see my PowerPoint screen? Okay. Okay, I will continue with my presentation. Okay. Hello, everyone, and thank you for coming to attend my presentation on the road to becoming a health professional. My name is Sonia Nath, and let's get started. So this is just a disclaimer that says that the author reserves the right not to be responsible for the topicality, correctness, completeness, or quality of the information provided. So as I said, my name is Sonia Nath, and I am a student in the MHSA, or Medical and Health Services Academy, at my high school. And I'm also a student athlete who has done track. I go to John C. Kimball High School, and I live in Northern California, and I'm also a dual enrolled student in community college. Last summer, I completed Stanford's high school healthcare administration academic program, and I'm also in a club called HOSA, and I am a state qualifier, and I qualified for nutrition and human growth and development between last year and this year. And I have some other certifications that relate to healthcare, such as HIPAA and CPR. And this summer, I completed a local medical program. And that's something that I'm going to talk about more later. And that's that you can find different local medical programs where you live so that you can get an idea of medicine and what career you might be interested in pursuing. So for today's agenda on the path to becoming a health professional, I will talk about why you should choose a career in healthcare. I'll give you information on how to become a doctor and nurse and other healthcare workers. I'll continue to talk about other healthcare professionals and the educational requirements needed to get there. Then I'll talk about healthcare administration, and then I'll go into careers in forensic science. And then I'll conclude with the advantages and disadvantages of choosing a career in healthcare. So I'm going to start by giving you a few reasons of why you should choose a career in healthcare. If you choose to pursue healthcare, you are choosing to make a difference in people's lives every single day. Furthermore, you will always have job security because a profession in the healthcare industry will always be in high demand. You will also be engaging in interesting work. You'll have a clear path for advancement. You'll be making a good salary. And moreover, you'll be making a difference in someone's life every day, whether or not that's up front and interacting with the patient, or even if that's behind the scenes. So now I'm going to describe how you can prepare for a career in healthcare during high school. So number one, you should take biology, chemistry, and physics courses in high school or community college. This is very important because any career in healthcare needs a strong foundation in biology, chemistry, and physics. And by taking these courses earlier on, it will help set you up for pursuing these later on. Second, you should participate in science fairs, Olympiads, and other clubs that are related to medicine or healthcare, like HOSA, which I mentioned before, but there's also Red Cross and other clubs that your school may offer. Another thing you can do is join a high school health academy if your school offers one. Some schools may offer it while others don't, but it's always a good idea to take science classes like biology, chemistry, and physics because those are all directly needed for a career in healthcare. Then you can do hospital or voluntary work like community service. And you can also shadow different medical professionals, especially ones that you are interested in becoming. So I recently shadowed a PA, which is a physician's assistant, and I also shadowed a internal medicine doctor, and that was really great because it gave me a unique perspective on exactly what a internal medicine doctor and physician's assistant need to do. So I really recommend doing that. Then in college, it's good to major in biological sciences, chemistry, or a pre-med program in college. Although it is not required to major in a science-related major in order to go to medical school, it's very helpful because it will help you build the foundations needed to take the MCAT. And I'll go over that as we continue in the PowerPoint. And then lastly, you should prepare for the MCAT or the medical college admission test, which is needed to apply to medical school. So here I have a graphic that shows the highest paid job in every state in the United States. And this is pre-pandemic from 2017. And as you can see, the highest paid job in every state is all different types of medical professions like surgeons, anesthesiologists, dentists, and other professions as listed. And you can see that they are all very important careers and they will always be in high demand. Here I have another graphic which is very similar to the other one, and this is in 2021. And this is not completely post-pandemic, but it does show you that even after the pandemic, doctors and other healthcare workers are still the highest paid career. So it shows that whatever happens, you'll always have a stable career if you go into healthcare. And they're in high demand. Here I'm going to be talking about the road to becoming a doctor. So there are 5 major steps outlined in this picture, and it starts with pre-med. So before medical school, students complete rigorous prerequisite courses in biology, physics, English, and chemistry, and this prepares them for the MCAT. Then there's medical school, which is 4 years. So often pre-med or an undergrad degree is 4 years, and the medical schools is the next 4 years. And that includes classroom-based, clinical, and community-based coursework, which covers science, problem solving, and communication skills. And different schools use different types of curriculum, but this is all needed in order to become a doctor. Everyone needs to go through medical school to become a doctor. Then there's the match. So during the final year of medical school, students choose a specialty on the basis of their interest, clinical experiences, and other factors. And then they apply to residency programs. And then on match day in March, students complete their residence training. Now we're going to move on to residency training. And this is generally at a teaching hospital, and it can take anywhere from 3 to 7 years, depending upon what specialty someone chooses to go into. So residency involves supervised hands-on training that must be completed in order for a doctor to be licensed and board certified and to practice independently. Residents train as part of a patient care team alongside other health practitioners. So during residency, they have completed medical school and they receive the title of MD or DO, depending on from where they graduated. But now they're just working alongside doctors and other supervisors to get in their residency hours and to get in that practice before they're allowed to go and practice independently. The last step of this process is certification, licensure, and continuing medical education, or CME. And this is an ongoing process which doesn't end because as new education is released, it's doctors' responsibility to stay up to date with new medical advances and practices. And physicians must obtain licensure in the state that they will practice. And there are 24 specialty boards that establish criteria that physicians must meet to be certified. So I just went over this really long process, and I just want to see if anybody has any questions about this. So I can just wait for a few seconds if anyone has a question regarding the path to becoming a doctor. If not, I can continue. Okay, it looks like no one has a question right now, so I can continue. Okay. So now I'm going to be discussing what is on the MCAT. So the MCAT, like I said, is the medical college admission test. And altogether, this is a 7.5-hour exam that you need to take in order to apply to medical school. And the total time it takes, excluding breaks, is 6 hours and 15 minutes. So this exam is broken into 4 sections. Section 1 is the biological and biochemical foundations of living systems. So it focuses on biology and biochemistry. The second part is chemical and physical foundations of biological systems. So it talks about more chemistry and biology. And the third section is psychological, social, and biological foundations of behavior. So this is psychology, sociology, or social and biological foundations and other behavior. And then section 4 is critical analysis and reasoning skills. So on the right, I have the breakdown of the MCAT, and here you can see that each of the sections take up about a quarter of the MCAT, but a lot of it is based on biology and chemistry and biochemistry. And there is some physics, some sociology, and some psychology, but a lot of it is based on biology and chemistry, which is why it's really good to take those classes from a young age, like throughout high school and undergrad, to make sure that you have a solid foundation in these areas so you can successfully pass the MCAT. Now I'm going to go into some medical professions. I've just listed a few in this PowerPoint. There are several others, but this is just to give you an idea. And another thing, based on the salary, these are dependent on different factors, such as where you are living, and also how many hours you work, and your licensure and different things. But so it's important to do your own research. But these are just general numbers from the U.S. Labor and Bureau of Statistics. So we have family medicine physician. This is a medical specialty within primary care, and it provides continuing comprehensive health care for the family. And people here make approximately $234,000. And the undergraduate the educational journey involves getting an undergrad degree, taking the MCAT, and scoring well to remain competitive, going through medical school, doing a 3-year residency, and having an optional fellowship. So a lot of these professions all have the same path that we already discussed, so I'm not going to go into further detail on all of them. The next profession is a podiatrist. These are physicians who diagnose and treat conditions of the foot and ankle, and their educational journey is very similar to the others. Another medical profession is surgeons. These are people who operate on patients suffering from diseases, infections, or deformities, and they can become general surgeons or choose to specialize in other areas like neurology or plastic surgery. They make about $250,000. An anesthesiologist is a physician who is responsible for administering general or regional anesthesia, which allows surgeons to do invasive procedures without the patient being uncomfortable. And they also have a similar process of education. Then we have orthodontists. These are dental specialties focusing on fixing dental irregularities in teeth and jaws. If you have had braces, then you're probably familiar with going to an orthodontist. And pediatricians, these are doctors concerned with the physical, emotional, and social well-being of children from infancy to young adulthood. And pediatrics is a specialty itself, but there are subspecialties available. Now I'm going to talk about a physician assistant. So a physician assistant, or PA, is a licensed and highly skilled healthcare professional, which is trained to provide patient evaluation, education, and healthcare services. And this is someone who works with the physician to provide medical care and guidance needed by a patient. Here I have a table that compares the education of a physician assistant and also a physician. So the main difference is that a physician assistant does not go to medical school. They have a 2 to 3 year PA program, and one of their years is clinical rotations, and then they have a different exam that they need to pass. It's not the USMLE, which is for physicians. It's called the PANCE, and it's the Physician Assistant Certifying Exam. So, as I said before, I had the opportunity to shadow a physician assistant during the last week, and I just want to say that based on my experience, I saw that a physician assistant is able to do a lot of the work that a doctor is able to do, but to a lesser extent. They are able to still work with patients and diagnose patients based on what's wrong with them, but they do need certain medical supervision when they're doing other things such as surgery and other things. They need to be supervised. So they are not completely as independent, but they are able to do a lot of what a physician is able to do. And their average salary is $121,000. Now I'm going to talk about the educational pathway to a nursing career. Nursing is another job in healthcare, which is also very important. Nurses can pursue a variety of educational paths to practice at different levels of nursing. So there's a certified nursing assistant, a Bachelor of Science in Nursing, a licensed practical nurse, and a Master of Science in Nursing. And then there's also a Doctor of Nursing Practice. And these are all different types of certifications and licensure that can take you to becoming a nurse. The average salary of a registered nurse is $90,000, but again, it can vary. Here I have a graph that shows the content on the NCLEX. If you are not familiar with the NCLEX, it is the test that registered nurses need to take before they become a registered nurse. So this is for nursing, and this is a distribution of the content. So some of it is physiological adaptation, there's health promotion and maintenance, psychosocial integrity, pharmacological and parental therapies, and different things that are on the NCLEX exam. Now I'm going to discuss a pharmacologist. So this is a different profession that is also available in the health field. Pharmacology is the study of how chemical agents, both natural and synthetic, affect biological systems. And a pharmacologist is someone who develops, identifies, and tests drugs to cure, treat, and prevent diseases. They conduct drug research and testing on biological specimens like animals, plants, and humans. So this type of a person doesn't work directly with patients. Instead, they're working in a lab setting and they're conducting research. So this shows that you can still be involved with medicine, but not necessarily directly with patients. Now I'm going to talk about healthcare administrators. Healthcare administrators are responsible for the coordination that goes on behind the medical facilities. They have just an important role in keeping the healthcare system going, and they have valuable work. They work along with physicians and nurses, and they play a role in improving the lives of many patients. Three top jobs in healthcare administration that you can have with a master's degree include being an executive director, director of operations, and a healthcare consultant. Again, the salaries can differ, so don't pay as much attention to that. But the fact that there are other positions available in healthcare if you would like to work in administration. So last year during my Stanford Healthcare Administration program, I was able to rotate through different rotations with healthcare administration workers. And I found out that there are a lot of different departments in healthcare administration. To name a few, there are faculty affairs, communications, lab managers, clinical outcomes, surgery coordinators, and other teams like human resources. And all of these departments are very important to allow hospitals to come together and work effectively. Now I'm going to talk about forensic science. So forensic science is more of a newer field that's emerging, and it is a branch of the healthcare industry which merges the medical field with law enforcement, and it is a growing field. So forensic science itself is the application of the science and terminology of science to the criminal and civil laws that are enforced by police agencies and a criminal justice system. And these are some of the requirements needed to have an entry-level position in forensics. So that would be a bachelor's degree in forensics or any other science-related field like physics, biology, microbiology, chemistry, medical technology, or genetics. And there are different forensic science programs available that can help you specialize. If you are interested in this field, taking classes in law and communication can be helpful. If your school doesn't directly have law and communication classes, another way you can get exposure to this is by taking classes with community college. That is something that I am currently doing. And I think it's really good because community college offers a wide variety of classes that you can take. And you may need other additional education if you want to go into a specific field. So I'm just going to go and talk about briefly some of the different fields in forensics because there are many different ones. There are forensic biologists, which are people who examine blood, bodily fluids, hair, bones, insects, and plant and animal remains. to help identify victims and criminal investigations and to support criminal investigations. There are forensic pathologists who help perform autopsies and other investigations. And there's also a laboratory animal scientist who works in the biomedical research facility. And they record information on an animal such as the genealogy, weight, and clinical signs of pain and distress. Other fields in forensics include being a forensic document examiner, which is someone who helps examine documents, such as examining the handwriting on documents to see if anything has been forged. There's forensic engineering, which is someone who applies the principles of engineering and science to investigate why something failed. Like in this picture, they would be finding out what was the cause of the bridge's collapse. There's also forensic odontologists who are highly experienced trained dentists who use their expertise to identify unknown remains and trace bite marks. I'm gonna go and check the chat right now to see if anyone has any other questions. Okay, it doesn't look like anybody has a question, so I'm gonna continue with my presentation. But feel free anytime to leave any comments or questions in the chat. So on this slide, I'm discussing healthcare and technology. So there are a lot of instances where healthcare and technology come together to improve healthcare for everyone and for a lot of people. So wearable technology is a great example of this and something that a lot of you guys are probably already aware of or already use. Apple's iWatch is a great example because it can track your personal health data and information, and that can help you keep track of your own health information. There are also other heart rate monitors and other things that detect your blood pressure and other things. There's also like sleep rings available that can help analyze the quality of sleep you have. Telemedicine is another field of healthcare and technology. During the pandemic, you may have experienced telemedicine yourself. Instead of going into a doctor's office and physically being there, you might have taken an online video call with your doctor or primary care provider. And that's an example of how technology allows medicine to be online. So on the right-hand side, I have two examples of how technology is being used inside of the hospital. So during my last week, I was in a program where I was able to go inside and learn about different healthcare positions in hospitals. And one thing that I learned about is the Da Vinci X iRobot, which is an example of how technology is being used to complete surgeries on patients. The Da Vinci X iRobot is a robot that is controlled by a doctor, but has arms and other machinery that helps to actually do the operation. And this gives patients an option to choose whether or not they want their surgeon to complete the surgery with like physically or with machinery. And machinery often helps surgeries be less invasive. Another example of how technology is used in healthcare is live interpreters. If you have a patient that speaks a different language than the primary care physician or whoever is helping the patient, then that language barrier can be removed by having a live interpreter, which is where someone from anywhere in the world can come on live and help the patient communicate with the doctor. And this also highlights the importance of having bilingual staff or staff in healthcare that can speak multiple languages so that they can address the needs of their patients. And in the San Joaquin Valley, that is something that is very prominent where people speak different languages other than English. So here I have come to the end of my presentation, and I'm just going to summarize the advantages and disadvantages of choosing a career in healthcare. The advantages include having personal satisfaction, having a high salary, job security, being able to positively affect patients, being able to save lives, giving life a purpose, and being a leader. However, there are also disadvantages to pursuing a career in medicine. There is a long education period, as you saw, with the road to becoming a doctor or even a physician assistant or a nurse or someone in administration. So that's why it's really important to be committed to medicine and to really be passionate about pursuing this career, because a lot of times when you are a doctor, you can't just suddenly change and go into a different career. That is your career for the most of the time for the rest of your life. So it's important that you are passionate about what you are going into. Another thing is that people in the medical field have a hectic schedule and long hours. A lot of time, doctors can be on call for several hours at a time and even weeks. So they are dealing with a lot. There's also emotional stress that comes with the job, because if you're seeing patients who are having like a difficulty or struggling with something, it can be difficult to handle that as you come home from work. There's also direct exposure to infectious diseases. As we all know, during the COVID-19 pandemic, healthcare workers were working upfront with several patients, and they are at a higher risk of being exposed to those infectious diseases. Another thing is that pursuing a medical career does have a high education fee. However, it's important to note that you shouldn't wonder how you shouldn't wonder that whether or not you'll be able to pay that fee. It's just a matter of how you're going to do it. There are loan forgiveness options currently available where if you work for a certain nonprofit organizations for a certain set amount of time, they can forgive your loans. And there are other programs like that where you don't have to worry about paying off those loans. Can be done. It can be done for you. There's also like other ways to get around that. But another thing to consider is that once you do reach your goal and become uh, pursue the career that you want to, you will be making more money, so then you can use that to pay off your loans. And a lot of people do that, but it's not something that should discourage you from pursuing this field if you are really interested in this. So thank you for listening to my presentation. I see that there is a question in the chat. I'll go and answer that right now. Okay, so the question is by Melanie. Where can high schoolers find opportunities in healthcare, such as volunteering or job shadowing? So this is a really good question, and high schoolers can find opportunities in healthcare through different like hospitals. Sometimes you can go and volunteer in hospitals and see if they allow you to. A lot of times the rule to apply to in order to volunteer at hospitals is to be at least 16 years of age, just because that is like a standard rule. but for getting exposure to healthcare, joining free local programs is a great way. You can also take different classes through your school or even with community college to gain exposure to different classes in science or in healthcare. There's also another question that says, what are some other careers in forensic science? So I listed a couple. I can go back to that slide and show you. Did you have a specific slide that you wanted to see or a specific career? I can go back to that slide right now. Okay, so these are just a couple of the ones I went over, but there are other opportunities in the field of forensic. You can be working with DNA and in a crime lab to help solve different cases and to help make sure that the person, like you can help find who is guilty and who is innocent in a crime. And I have some experience with doing some of the processes that they use in forensic science. So if there is a crime scene and forensic analysts need to determine who is guilty of that crime, who is innocent, they can use PCR or polymerase chain reaction. And this is where someone makes multiple copies of a specific segment of DNA and it's amplified. And in about 2 hours, someone can have billions of copies of that sequence, and then it can go through gel agarose electrophoresis, and that can help forensic analysts to analyze the DNA and find out who is the crime, who is guilty and who is innocent in a crime, and that would be in forensic as a forensic analyst. There's also jobs like other ones, as I said, like in pathology, lab animal science, and engineering as a document examiner and as an odontologist. Did that answer your question, or did you want some more information on that, Simra? Or for now, I can leave it at that. Also, High School Navigator has resources available to help students that are interested in researching more about different programs available in the medical field. So I can show you the tool that High School Navigator has developed and as a team. So if you go to highschoolnavigator.org, you can go to the medical programs, and if you click it on the top, you'll see that there are several different programs that you can find more about. So there are DO programs, MD programs, dental, physician assistant, pharmacy, and optometry. And how this works is that if you're interested in MD, you can click on that and it'll give you several different programs that are available for people who want to go into these programs. And these are accelerated programs. So if you're really sure that you want to go into medicine, then you should look into accelerated programs, which combine your undergrad, which is your first 4 years, with your medical school, so that you can graduate medical school and undergrad in a shorter amount of time. And this tool allows you to go in and find information on different programs that are across the US. And it also gives you the information or the coursework that you need in order to apply for these programs. And it gives you a description of these programs. So that's a really good tool. It also tells you the locations and the class size, as well as how many students at the school are male or from in-state or out of state. And it gives you enrollment data per race, which is also really good to see if you want to know what the demographics of the population are at that school. Does anybody have any other questions regarding healthcare and or the road to healthcare and the path? If no one has any other questions, I can talk a little bit more about the programs that High School Navigator has online. And then I can wrap up the webinar. So I showed some of the different ways that you can use High School Navigator to find programs, but you can also select the state that you're in. So for example, I'm from California, so I can go in and type California, and if I'm interested in an MD program, I can click there. And this is one of the schools that comes up, and this is the California North State University College of Medicine, which offers a BSMD program. Another thing that's good is that for some of them, it'll tell you the MCAT score you need. So you know what to target when you're taking that exam. And there are other different programs that you can also search through. I was personally involved in collecting research for the physician assistant program. Okay, and I'll just wrap up on my last slide and wrap up this webinar. So thank you everyone for listening. Let's connect on LinkedIn. Here I have my LinkedIn, and I can put it in the chat so that you can connect with me on LinkedIn if you have an account. And I hope that you found this presentation helpful and that you were able to get information from it that you wanted. And that's helpful too. So I just posted my LinkedIn in the chat, and that's where you can find me. And then I'll also give the link to the High School Navigator Medical Program, so you can look through it. Thank you for everyone who joined, and that is the end of my presentation.